a pivotal moment in my career happened very early in my career. I was working for a nonprofit organization focused on hospital quality and safety. This was my first job right out of college. So I was a 21-year-old, just starting my career in DC. And my younger sister got a pretty rare and scary medical diagnosis, which of course was very frightening for the whole family. And we really didn't know where to turn to. We couldn't find the right specialist in the United States. That's just how rare the diagnosis was. And I was so fortunate that my CEO and my boss at my organization helped tap into their network of clinicians and hospitals to end up finding her the top specialist in the United States. So she ended up getting a referral to NYU Langone. And after that referral, I think they were able to see her within 2 weeks or so, which was incredibly helpful for her overall healing and health. But it occurred to me, especially while I'm getting phone calls from my grandparents and my parents, thank you so much, Alina, for helping your sister to get this appointment. It occurred to me that I was able to do that because of the unique position I was in. I was working in healthcare. I was working, with executives who had power and who were able to, put an appointment on a schedule. And that's not something that every American is able to access. And so I studied health policy undergrad. I always knew I wanted to work in healthcare, public health. But this was kind of a personal moment where I said, okay, this is going to be my career and my life calling, to make sure that people just like my sister can get access to high quality care when they need it, especially at a scary point or a diagnosis. And they can get that without knowing someone. So that was certainly a pivotal moment, and one that, I think about most days, especially on a stressful day, when I remind myself, what am I doing? So certainly that moment for me. So I would say the book When Breath Becomes Air by Dr. Paul Kalanithi. It's a memoir of a neurosurgeon. And he talks about how his attitude and life changed before dying of cancer at age 37. So I read this book shortly after I left DC and moved down to Nashville to work for Cohere Health, which is a home-based palliative care company. And our chief medical officer at the time, Dr. Andrew Lasher, suggested I read that book because I was feeling a little uncertain about working in palliative care, hospice type care, because I was feeling like I was focused on death care instead of healthcare. And I couldn't have been more wrong. This book talks about respecting the end of life is just as important as valuing life and celebrating life in healthcare. And so his wife actually puts it best in the book when she talks about his decision to not avert his eyes from death epitomizes a fortitude that we don't celebrate enough in our death avoidant culture. So not to be morbid and not to be, sad, but I think it's something that our delivery system can do a better job of, which is really putting the patient at the forefront, thinking about their wishes, thinking about what's important to them, what are their goals, not only at the point of mortality, but also at the point of injury or chronic condition. At Cohere Health, we are very focused on patient goals, the patient journey. A lot of our care is focused on that. And, it could be as simple as a patient with a knee problem. What's important to them? Is it going out and playing pickleball with their friends? Is it walking their daughter down the aisle? So really putting the patient at the forefront. And I think it's a book that anyone in healthcare would benefit from, whether you're a clinician or working on the business side. Definitely one that I enjoy and I would recommend. can't hide this. I'm gonna go with reality TV, the Real Housewives franchise on Bravo TV, and a glass of red wine.